Good afternoon. My name is Brian Carey, VP of Marketing here at Unbound Medicine. Thank you for joining us today as we present to you a series of short webinars titled COVID-19, Are We Getting Ahead? Today, we will be discussing managing stress and coping with COVID-19. This pre-recorded presentation will last about 10 minutes. Please feel free to chat in the window provided and ask questions from fellow listeners. The recorded webinar will be shared with everyone via email and uploaded to Unbound Medicine's YouTube channel. Now, please let me introduce our presenter, Dr. Traci Speed. Dr. Speed is an assistant professor of psychiatry and behavioral sciences at Johns Hopkins School of Medicine. She's an attending psychiatrist of the Johns Hopkins Pain Treatment Program and chief psychiatrist of the Johns Hopkins Perioperative Pain Program. She completed her MD, PhD, psychiatry residency, and research fellowship at Johns Hopkins. At this time, I'll turn it over to you, Dr. Speed.
Thanks, Brian. So this has been a very unpredictable and stressful time for us as we're dealing with COVID-19. So I'm going to talk about some strategies to manage stress and help with coping skills. So stress is a universal experience that we all feel at some time. And just as a reminder, our body responds to stress by releasing cortisol and adrenaline. And this tends to activate our sympathetic nervous system, which we often think of as our fight or flight response. And it can also inhibit our immune response. And that can affect the way our body deals with systemic illnesses such as diabetes and depression and cardiovascular disease. We also tend to change our behaviors when we're stressed, and studies show that people tend to have changes in their sleep or eating habits and have changes in their mood, such as irritability or guilt, and also some changes in their vitality. The good news is that studies show that we can improve our management of stress through techniques such as building resilience. So one question is, what is resilience and how do we find it? So resilience is our ability to overcome negative experiences and adversity. And one way to think about it as to bend with stress rather than breaking. And it is, again, something that we can build and something that we can develop and practice. And anyone can do that. So there are a number of evidence-based strategies to be able to build resilience and to help your management of stress. And I'm going to talk about 3 of them. One of the techniques to build resilience is called cognitive behavioral therapy. And that's just kind of like it sounds. It's the process of learning to challenge your thoughts and to change your maladaptive or negative behaviors in order to change your feelings. A simple way to think about it is to think about changing the channel. So instead of watching a scary movie, you might change the channel to a comedy. And one way to change behaviors is to find motivation to do things that might be healthier, like increasing your exercise routine, or deciding to eat a healthier meal, or remembering to do something that you really love doing. Cognitive behavioral therapy is frequently used for patients that have high anxiety or depression, and could be something that can be used during this time. Another evidence-based strategy is the concept of positive psychology, and that's really focusing the mind on more positive aspects of life. What are some ways to do that? Some might be journaling. So maybe evenings you might journal 3 positive things that happened during the day. Another one is expressing gratitude. Remember to thanking the people that you care about or love or that you appreciate. One other common strategy is mindfulness. Now, I tend to find that people find mindfulness daunting or are worried about it or scared about it, but it isn't actually that daunting. It's the concept that you can practice distraction techniques and try to move your mind away from some of the negative thoughts, oftentimes by focusing on an experience that you're engaged in. So for example, maybe while you're washing the dishes, you're really focused on the sights and the smells and the feel of the water. There are more formal mindfulness-based practices like meditation or deep breathing. And again, there's some informal strategies that you can use on a daily basis. So managing stress does take work. and it's something that involves practice. And practicing can be better than worrying, and it doesn't have to be perfect practice, but similar to playing a musical instrument or learning a new sport, it's something that you might want to work on every day. So during the COVID-19 pandemic, what are some kind of ways that you can work on these strategies every day? The first is to remember that there's some things that we can control and some things that we can't. And one thing is to focus on what needs to be done today. What can we control today? Next is just to remember to breathe. The other is to set some limits in our daily routine. So perhaps you want to limit the amount of news that you're watching or reading, limit the amount of rabbit holes you go down during your internet searches. And one important reminder is to limit the amount of alcohol or other drugs that you may be using. So alcohol is a depressant for our brain, and while it may make us feel good in the moment, could sometimes ultimately make us feel worse down the road. It's also important to remember that mental illness is often stigmatized, but there are times when we need professional help. And there are people who might have anxiety or mood disorders, or may develop new anxiety or mood disorders during this time. And if you feel that there are changes in your personality or your response to fear, it may be time to seek a therapist or a counselor or a psychiatrist. The good news is during this time is that many health professionals have been able to convert to telemedicine or e-health or even telephone calls. It's also important to think about children during this time. And children often express their anxieties and their fears differently than adults. So for those who work with children or have children, it's important to allow them to validate their feelings and to be truthful when answering their questions or concerns. And sometimes it's okay to say, I don't know. For those who are the first line responders, it's common to experience some burnout or even some secondary traumatic stress later on. Again, there is professional help available, and if someone feels that their functioning or daily living is not at the level that they would expect, it's okay to ask for help. One of the most important things for dealing with stress is to remember to protect our sleep. And there are some simple ways that we can work on helping to regulate our sleep cycle and engage in sleep hygiene. An important thing is to remember to create a schedule every day. There should always be an end of the day and a chance when we separate ourselves from our work. Another is to wake up at a consistent time. So currently a lot of people are working from home and people are no longer socializing with friends in person because of social distancing. So it's important to remember to create schedules, which may include setting up meetings in the morning or even virtual brunches with friends on weekends as a way to get out of bed. Also remember that light affects our body, and so it's important to unplug at the end of the day and to spend some time away from phones and tablets and computers. It's sometimes okay to sit in front of the television. That doesn't affect, that light won't affect our circadian rhythm as much. And finally, when we think about kind of spending time in bed, you don't want to spend all day in bed. You really want to only be in the bed when you're sleepy. So if you're having difficulty falling asleep, get out of bed and then go to bed again when you're sleepy. So the average adult gets about 6 to 9 hours of sleep. Ideally, we get about 7 to 9 hours of sleep. And one slight tidbit would be to maybe, since you're home more often, is to take advantage of the opportunity to change your bedtime and to possibly try to increase your bedtime by going to bed about 15 minutes earlier about each week and see if that can help increase your time. So those are some overall strategies to try to help manage stress during this time. In summary, I think it's important to remember that we are all affected right now by COVID-19, and it's a chaotic and challenging time. So overall, remember to breathe and to think about those things that you can control and to seek out support when needed. Thank you.
Thanks so much, Dr. Speed. I also would like to thank all the attendees for coming out today. If you need more information about the Johns Hopkins Guides, visit hopkinsguides.com. The Managing Stress and Coping with COVID-19 topic within the Johns Hopkins Psychiatry Guide has been open to the public and can be viewed anytime. For more information about any of the Johns Hopkins Guides, or making them available at your institution, contact sales@unboundmedicine.com. Again, thank you so much for your service. Stay safe and stay healthy. Have a great day.